Hi, this is Clement once more, and welcome back to the channel. I apologise, it's been a while. I've had a busy start to the year. And yeah, I see I have some more new subscribers and more people watching videos from this channel, so I think it's time I recorded something new and shared perhaps something current, perhaps from my practice, those things that are working for me and my clients at this time. So one of the things that we explore in therapy is the client's state of mind, and we explore the emotions. So the emotions that are kind of like the symptoms that we get, and underneath those emotions we can find thought patterns. We can find thoughts that we have, such as I'm feeling anxious, I'm feeling worried. They're these kind of thoughts that come into our head on almost a repeated basis, or maybe they're just one-offs. And I think one of the things in our human condition is we can sometimes take these thoughts as being us, that we're not somehow separate from them, and hence that we have to have them, that they are. And the fact that we have certain thoughts can make us a good or a bad person in our own judgment. So as a result, this can cause a certain amount of stress and anxiety about actually having the thought, not just the stress and anxiety that thought pattern might be creating. So what we look to do is to intervene in that process, in the thinking process. One of the ways in which we can discover more about these thoughts and thence to go about changing them is to start some kind of written or audio journal. So essentially, when a thought comes up for a client, for them to write it down in with as much honesty as possible, not holding back, to write that down in a journal, just for them, just for their own eyes, that they can optionally share with the therapist. And after a while, for a few weeks perhaps of doing this kind of journaling, themes will begin to emerge. There will begin to be perhaps connections between those troubling thoughts and the emotions associated with them. And so once we've captured perhaps some of those thoughts and we understand what they are, we can begin to look at them. We can start to see, are they actually true? Is what they're thinking, is that valid? Can we ask the question, is that really the case? So in Byron Katie's book, Loving What Is, she looks into a way of questioning our thoughts. And this, I think, is possibly also known as Socratic questioning, where we say, is that really the case? Can we prove that that's the case? Or is this just our mind up to tricks? So we hold up these thoughts to the light and we see if they stack up. If they don't stack up, we will begin to start to reject them in our mind, because, once we see something's fake, we can't sort of unfake it again. Now we've seen it as fake, it no longer has that sort of aura of where you just can't sort of challenge it. When you can see that it's fake, it can be challenged and looked at as such. And so that's one way of dissolving some of those thoughts, especially those which are not true or perhaps open to interpretation, where if we see ourselves in our best light, as we as therapists are encouraged to do, does that thought still stack up? If we see ourselves in our best light, is that thought true? So that's one way of dealing with some of those thoughts. Another method that I like to use is the method of using affirmations. And affirmations would be positive statements describing a state that we wish to be in or wish to exist. They are positive statements, so they're stating something positive. So we could associate affirmations with the idea of positive thinking. Now, I'm not one for mindless positive thinking. It needs to be realistic. So there's a sense of realism to those affirmations that we are putting in place. If we don't really believe the affirmations that we're using, then I don't think that they work quite so well. But if we can have affirmations that at least we can kind of aspire to, that we can imagine being the case, the key, I think, is often the imagination here and the belief that we inject into them. And so by thinking of these positive statements, we can, when we have those troubling thoughts, we can swap out that thought with a positive version of that. So we look to reframe it, if you like, to reframe that thought in a positive light. We could talk quite a lot about affirmations, but this is really intended, I suppose, as a sort of overview, but it might be nice in the fullness of time to sort of go through perhaps a list of good affirmations that are out there. But in the meantime, if it's something that interests you, then the great Louise Hay in her You Can Heal Your Life has some very fine affirmations there. At the moment, one that I find useful is, for example, I am safe and well. I am safe and well. I am safe and well. You can try saying that and seeing how that resonates with you. Say it a few times in your head, or perhaps say it to yourself in the mirror. That could also work. So that's a little bit about the affirmations there. Again, there's more detail we could go into with these things. I say this video is perhaps more of an overview kind. The other thing is perhaps to mention the power of visualization. Now, I refer to the power of imagination when we're talking about the affirmations. Well, visualization is also important. So it can be about visualizing yourself in the state you wish to be. And this is something that many successful people, such as sports people, will use to visualize their goals, to imagine it. So it gives the brain an idea of what it's seeking to achieve. It's almost like you've kind of put a template there, and it's then up to the rest of you to kind of fill that template in to make that a reality. Some of you may recognize some of these techniques from sort of some of the popular psychological books, like The Secret, for example, or when we talk about manifesting things. And I would say that's probably a topic for another day, but also one that I personally find interesting. So I think that's quite a sort of a fairly large and wordy video by my standards. I hope, as always, that this is useful. I hope this finds you well. I hope that you realise out there that you're not alone. There are lots of people out there who can assist you, and even on a sort of virtual level, I'm here with you. So if this video was useful to you, if you liked it, please do like it. If you like the content, then please do subscribe or share the video. Share it with people who think might find it useful. All of this is really just to help this channel reach more people. Also, I should say that I am a counsellor, so if you want to book in sessions with me, then I do online counselling via Zoom, and we've also got face to face here in Cornwall. I do also do some contracting counselling outside of this as well, and so you might find me there too. So I wish you all well, and I will see you again soon. Bye for now. Bye. I read some time ago by Byron Katie, a book called I can't believe I've forgotten the name of it. We should have to edit this bit out.